So for over a decade, CAMS services across the UK on a yearly basis did a mapping, and they sent it in to map to see what referrals were going into CAMS services. And still it's the same kind of picture, is the most referrals are for anxieties, for low mood / depression, and for behaviour conduct problems. So then we move on to 2017, when the government introduced a paper transforming children and young people's mental health provision in the UK. So that's the mental health support teams. Can I have my next slide, please? Thank you. So thinking about the problems that were coming into CAMS, what they did is they brought in some particular training, some particular teams that could help to reduce those referrals into specialist CAMS services, but also to make sure that young people got the support right from the beginning. So it's about trying to get in there really early. From the Thrive model, where at the getting advice and getting help, and you can see I've done the getting advice at green, so that's the first one, and the getting help is the blue one. So our team, we deliver evidence-based interventions for children and young people with mild to moderate mental health problems. So, for example, Incredible Years is 12 sessions with parents. It's over 12 weeks, and it's evidence-based for conduct and behavioural problems. CBT is evidence-based. We offer 8 sessions for young people for things like worry management, panic, low mood, things like that. The other part of the role that we've got as a mental health support team is that we engage with a number of schools, and they're an identified number of schools, and we start working with the school on what we call a whole school approach. So it's about thinking with the senior leadership, the pastoral team, everybody that's involved with the child's emotional mental health, thinking with them of what the school, where the school's at, what kind of things they might be lacking, what they need to move the school forward so that the school is a emotionally kind of well place to be. We know that there's some huge schools out there. So the things that we might do is we might do some assemblies, we might do some staff training, we might do some group work with the young people, we can do some things with parents, the world's our oyster in that kind of element. And then the other thing that we do is we give advice to school and college staff. We do have one college, which is Craven College. We give advice to school staff, and it's usually about how to access other support. We know that it's a little bit of a minefield. We're trying to make it clearer, but it is still really difficult. So it might be thinking about, you know, what is that young person presenting with? Why is it not us, and who could it be? So next slide really quickly. So request for support. You request it through your school. Parents can speak to anybody at school. If you've got a mental health support team, dead easy. Speak to anybody at school. The young person can speak to anybody at school or speak to the EMHP. There'll be posters up around school. A referral can be sent into our inbox. And what we then do is we look at the referral, speak to the parent, get some consent, have a think about what might be going on, do an assessment with the young person, and then think about, are we the right service to offer that intervention, or is there more appropriate service around that we can then help the young person to access? We won't just send a letter saying we're not the right person, we'll help you to access. So moving on to the schools, because I'm sure you all probably want to know, are you in our school? We've got schools in Bradford East. Now each team has a child population of 8,000. So if you move on to the next slide, you can see which schools we've got from Bradford East. This is thinking about, you know, each of those schools, the kind of total children population adds up to about 8,000. So we're up to full capacity in our East team. In the Keitha team, if you move slides, we will be up to capacity. Some of these are proposed. Sorry, that was the end of my 5 minutes, but I'll keep talking. Some of these are proposed because in the first year of our team being established in that area, we need a training year. So we start off small and we'll grow it to the 8,000. In the Craven team, which is the next slide, these are the schools that are involved. Now you'll see on this one, it looks like there's lots more schools. That's because of Craven College. Craven College takes up a huge amount of our capacity, but in real terms it doesn't. So we've added more schools that bring us up to 8,000 and counted Craven College as much less. And obviously the schools over there are much smaller. So moving on to Bradford South, you'll see that it doesn't look like we've got a lot of schools. That's because they're still in their training year. So what we're doing now is we are looking at the schools around that area that want to be involved. We're also looking at the deprivation index data to look to see where we need to be involved. And then by January of next year, we will have liaised with the schools and be going into those schools. So if we move on to the next slide, which is my final slide, is what do you do if we're not in your school? So if you don't have a mental health support team in your school, there is a primary mental health worker. There's a team called the EEWP, which covers the schools that we're not in, and both can be accessed via the school SENC or the pastoral care or through primary care. Now, at the moment, just my final bit is we're only up to 30% of child population in Bradford. We have been guaranteed another 3 teams, which takes us to just over 50%. We're really pushing using the data that we've got from the Born in Bradford research, working with West Yorkshire to become 100% coverage over Bradford.